Hello, everyone. My name is Malia Ellis. I am the veterinary sales manager here at Erchonia. Wanted to say thank you so much for joining us this afternoon or this morning, depending on what part of the country or the world that you are joining us in. We have today Dr. Rachel Starr, who is not just a veterinarian, but she does a lot of holistic as well as mainstream medicine. And she's going to be pairing all of those things together today in her presentation. She talks about some of her multiple modality practice that she has. She's been using the Erchonia low-level lasers for about 12 years now. So she's got a lot of really great experience with that. And so she's here to share some of her testimonials and how she uses the lasers in her practice now. And stay tuned at the end of the presentation because we will have a presentation about the differences of the newest generation of the lasers that we offer, from the new research that's been launched and published recently, as well as some really great specials for everyone. So without further ado, Dr. Starr, if you want to go ahead and start over there, and then I'll take over when you're done.
All right, thank you. So when Erchonia asked me if I would do a webinar for them, I asked them what they wanted me to talk about. And I said the reason that I got an Erchonia, or one of the major reasons, there were several, was because I had the ability to create an individual protocol for each individual patient. And I think it's very important to look at each patient as an individual and what it is that this individual needs, because it varies from patient to patient. And so I look at the laser as a tool in my toolbox, and I have multiple tools in my toolbox. I've been through several different areas of veterinary medicine. I started out as a large animal veterinarian, and mixed, but I did a lot of herd health. And in doing herd health, nutrition was something that affects, a whole herd, and we were taught to look there. But when I was in school, we were also taught, with low production in dairy cattle, to look for electromagnetic fields, which was an introduction to some extent for me to the physics of medicine, not just the chemistry of medicine or the gross, the physical aspects of medicine. And so I was open to those things, I would say, early on in my career. And then I became a shelter medicine doctor for a couple of years, and I honed my surgical skills, and I became a surgeon. And when I went into small animal practice, I became very surgically oriented. And over time, I was looking for new tools in my toolbox, and I trained in veterinary orthopedic manipulation, and I was introduced to lasers, and I asked my boss for a laser, and they're expensive. So he said, you need to bill for it, because somebody else in our clinic had asked for a Tonopen, and it had been used twice in the previous year. And so I promised him that I would bill for it. And we used it a lot, and we were getting very good responses from it. We had a new practitioner join our clinic, and he was interested in laser therapy too. And at the time, we had, my first one was a PL5000, and that was a red light laser. And I had really wanted a violet head laser. I wanted a base station, which at the time that we got the PL5000, it was about $13,000. And that to me was a big investment for our clinic. It was 2011. And I didn't want to ask for something that wasn't going to bring income into the clinic. I wasn't paying for it, and I didn't own the clinic. And that was even more important to me than had I owned the clinic. Then it's just me losing something, not other people. And about 2 years after that, I worked out of 2 clinics, and I was transporting the laser between the 2 clinics. And I talked to my boss. I wanted a violet head laser, about getting another laser so we could have one in each clinic. And then the laser, I write a protocol, the laser gets billed for when I'm not even there. I could bill when I wasn't even in the clinic. And because the techs could use the laser, I just wrote a protocol for them. And this other veterinarian went with me to a conference where Erchonia was, and I called my boss and said, well, we're here, there's a special for the base station. And he said, well, ask him what it would cost to get 2. And I said, 2? Like, I was so excited about that. And he said, well, yeah, we'll trade in the old one. Don't you want the violet head for both clinics? And I said, I do. And we made a deal with Erchonia to turn in our old laser. I think they gave us $4,000 or $5,000 for it. And then we got base stations at 2 base stations. They gave us a deal to get 2. There was like $3,000 off on each one. And I came home with, or we got the 2, and then we were supposed to package up the PL 5000 and send it back to them. But we had a technician who was using it as a rehab. She was a rehab technician, and she was going and using that laser in people's houses. And in the end, what we ended up doing was giving Erchonia the $5,000 back that we had, and kept the PL 5000 as well. So my boss saw the laser as being worth enough that I was billing for it enough, and I was the only one using it. And I only work 2 days a week. He saw that as a valuable enough tool that we ended up with 3 of them. So this has been a tool in my toolbox that I use frequently, and I bill for a lot. So for those of you who do acupuncture, I do not do acupuncture, but I see acupuncture as another tool in the toolbox. I'm very into non-pharmaceutical and non-invasive therapies. And also for those of you who do rehab physical therapy, PEMF, I think that's another really valuable tool in the toolbox. We do have a rehab veterinarian within our clinic and we work together a fair amount. And I will write laser protocols for a lot of those patients. So I put photochemical versus photothermal lasers up here, and I will get into that a little bit when we get into the physics of it. But whatever the tools are that you have in your toolbox, you can add whatever tools you want in your toolbox. I think that this is a really valuable tool to me, but so is nutrition. Now I do a ton of nutrition too, and I use a ton of nutritional supplements because this is the #1 tool in my toolbox. The laser is the second tool in my toolbox. And when we get into adjusting, and then I still do surgery and medications at times. I think that there are times when they are needed, but they're not my first choice anymore. Okay, so let's get into the physics of laser therapy. So a laser is monochromatic, directional, and coherent. Natural light is none of those things. The sun puts out all different wavelengths of light in all different directions, and it is non-coherent. The wavelengths are not lined up. As you can see to the right, there's a little picture there of sunlight, many colors, and they're not lined up together. LED lights can be monochromatic, and they are non-coherent, which means the wavelengths are not lined up, as you can see in that second. When Erchonia does research, an LED is used as a control. So it's it's monochromatic, it's a red light, like the laser, or there are other wavelengths of light too, and we'll go into those in a minute. But it's non-coherent light. And so that's the control. And then wavelength of light. So we want wavelengths of light within the visible light spectrum is very important. This visible light spectrum is safe. And I'm going to go into that on the next slide as to wavelengths of light and where they fit in visible versus infrared and ultraviolet. But the visible light spectrum is very safe. You're not going to cause any damage. So we want wavelength within the visible light spectrum. And then power, I'm going to actually let Malia go into power for the Erchonia lasers, but we want the powers to be somewhere between 2.5 and 7.5 milliwatts per centimeter squared. My lasers, I have some that are 5 and I have some that are 7.5. And when people talk about more power, I will tell you, my lasers work fantastically. You do not need any more power. Power comes with more risk. Energy. So the energy is the amount of energy that is contained within a wavelength of light. And it is inversely related to the wavelength of light, which means the shorter the wavelength of light, the more energy it has. And we're going to go again on the next slide through the whole electromagnetic spectrum and where energy falls in the importance of energy. So shorter wavelengths of light, more energy is good to an extent. And there's a reason for that, and we'll get into that. And then the frequency is the one thing that to me, I can individualize on my laser. The frequency is how fast the light blinks, and it is measured in hertz or cycles per second. And this is something that is programmable into the Erchonia lasers that I have yet to find another laser that you can program the frequencies into. You can choose different frequencies to some extent in some of the lasers, but they're already pre-programmed for specific things. Like there might be an inflammation protocol, but with the Erchonia, you can put in specifically what frequencies you want to use and target specific tissues. Okay, so this is the electromagnetic radiation spectrum. And you can see right there in the middle, there's this really narrow band of where visible light is. And in this visible light spectrum, the wavelengths of light contain the right amount of energy. So in the red light spectrum, we will have a package of energy that is anti-inflammatory. And when we get kind of into violet, we have more energy. And I'll get into that more on the next slide, but this is all safe because in this zone, it will excite an electron on a molecule, but it won't knock that electron off. And we can move energy through the entire body this way. So electrons excite, but then they discharge that energy, and that energy moves on to the next molecule. And so essentially, until this wavelength of light gets absorbed by the mitochondria within the cell, it will move through the entire body. We don't need to worry about penetration and power because in the visible light spectrum, these wavelengths of light will move from molecule to molecule just by exciting electrons and then emitting that wavelength back, and then the next one will pick it up, and they don't want to be in excited state, so they come down and they emit that light until they come into a situation where they're absorbed in a mitochondria, and then the mitochondria will use them, and we'll get into that. That's where the magic of laser therapy happens, is in the mitochondria of the cell. So in the visible spectrum, that happens. When we get into the infrared, so when we get to the right of that, the wavelengths are longer. They do not raise the energy state of the electron. They move the whole molecule and they create heat. So this is infrared lasers would be having a thermal effect. So they are photothermal lasers, and they have a thermal effect, and they warm the tissues, and this can be beneficial in some ways, but it's not the same as what we're going to talk about with increasing ATP in the mitochondria. That's a photochemical effect. So when we get into the infrared spectrum, we get generation of heat, and then we have to worry about burning with these lasers, so thermal burning. And we have to, in order to get penetration, we do have to increase power. So in the infrared, and this becomes even more pronounced as the wavelengths get longer and become microwaves. We all know microwaves we use to heat things, and these are pretty big wavelengths of light, to the point where the screen on your microwave has little holes in it, and they're too big to go through those little holes. That screen blocks the wavelengths coming through the microwave. So infrared, microwave, you get a more and more thermal effect until those wavelengths get too big for that, even essentially, and then we get into radio waves, and the radio waves are safe. So, but do not have a photochemical effect in the cell like the visible wavelength does. So infrared, we get into heat generation. And then when we go to ultraviolet, we get so much energy in that wavelength of light that it will knock that electron right off of the molecule instead of just exciting it and then releasing it to the next molecule. So when we get into ultraviolet light, we get into ionizing radiation. And obviously, the further we go down here, the more ionizing we get for radiation. So X-rays, we actually use this to create pictures with. And then when you get into gamma rays, they become, that becomes radiation sickness, right? I mean, and everybody knows it creates the Incredible Hulk. So who shouldn't have lived through all of that gamma radiation. So it becomes more dangerous the more energy that that is put into, or that the wavelength contains. It's more damaging. So ultraviolet light is ionizing radiation. We get sunburnt from ultraviolet light. It is not a thermal burn, it's an ionizing burn. It's inflammation in response to damage to the cells from ionizing radiation or from knocking the electrons off of the molecules. So obviously we want to avoid that. And then the thermal effect can be used to some extent, but it can become dangerous, and we can get thermal burn if we move into infrared. So that's what makes this visible light spectrum safe, and the best one to use as far as laser therapy goes is that it just excites an electron and then moves on to the next one and moves via the system just by exciting electrons. And it will move through the entire body that way. Okay, so this is the mitochondrial electron transport chain, and this is where the magic happens. Different enzymes within this membrane have the ability to absorb a wavelength of light, and the end result in different wavelengths of light will actually act on different enzymes here, but the end result is the creation of more ATP within the cell. So essentially, we're trying to harvest a package of energy that is a wavelength of light and turn it into chemical energy that is ATP. And with the formation of more ATP in the body, we get more DNA transcription. The cell basically is going to do whatever it does better. So it can help in healing. It can help in, even when you have dysfunction of organs like kidneys or liver, or I even used this on brain and spinal cord, versus you wouldn't want to use an infrared laser in those areas because they can be damaging. This is safe and can help those even nerves to perform better. I have lasered animals before that have nerve damage, and while you're lasering them, the muscles start twitching of whatever the nerve root is that you're lasering, because you're starting to get movement in that area. You're starting to get nerves to work. So if this feels a little bit sci-fi to you, like, oh my God, our mitochondria can absorb wavelengths of light, this is chlorophyll, which if you look at, which we all know absorbs light and makes energy out of light, the sunlight. So this is a very similar electron transport type chain mechanism in the cell membrane in the inside of the chloroplast. And we end up creating energy via the Kelvin cycle. And it is different than what happens in the mitochondria, but the mitochondria also have this ability to harvest wavelength of light. So if you look to the right, you can see the wavelengths of light that are best absorbed by chlorophyll and carotenoids. And if you look at where the two peaks are in there, you will see that one is around in the blue-violet area, and the other one is up in the red light area. And this is also true in the mitochondria, and hence why the two lasers that Erchonia would market to you are in the violet area and are in the red light area. Okay, so demand for non-pharmaceutical care in veterinary medicine is, I think, increasing rapidly. My personal experience with this is I'm booked out probably at least 4 weeks or so with my own clients, but sometimes, and I only take special requests, I don't take in regular clients, but sometimes I work for somebody else who's on vacation, or I will agree, like in our clinic the other day, I agreed to work. I usually only work till about 2 o'clock, but I agreed to work until 5 because we didn't have another veterinarian in the clinic and they wanted somebody to be able to see some regular appointments. And when I do work in this capacity where I see traditional clients, I would say that about 50% of them request me from that point on, because I talked to them about things that they can do preventatively, nutritionally, non-invasively in their pet. And they don't want to give their pet a daily medication. They want a way out of their allergies without Apoquel. They want to talk about things that are non-pharmaceutical and non-invasive. If they can do something without surgery, they want to do something without surgery. And so I would say I get half of those as regular clients. 90% of these patients, when I see them, if I offer them some kind of non-pharmaceutical care instead of pharmaceuticals, they take that option. And even if it's, hey, I heard a heart murmur in your dog, the dog doesn't have any symptoms, we wouldn't medicate them yet, we wouldn't do anything, but I have a nutritional supplement for that. They take that, they want that. And then there is an increasing trend in owners and an interest in alternative medicine, especially the millennials, and they have fur babies instead of children. When they do have children, they're having children far later in life. And so they're young professionals with money who have fur babies, and they don't want to put their fur babies on medications and they don't want to do surgery. So the more non-invasive therapies that you can offer them, the more compliance you're going to get. And I think compliance is really important. I look at individualizing something, not just to this patient, but also to this household. I think that a lot of people, it's a philosophical thing as well. And some of these patients can be difficult for traditional veterinarians because they decline a lot of things. But I find them, I will have people who come in and say they don't trust vets, they don't want this or that or whatnot, who are natural people. And all of a sudden they're bringing their pet in to see me monthly for me to be able to figure out what's wrong and get them on a non-invasive, non-pharmaceutical path. And so this is an area to tap, I think. So, and then the Erchonia lasers hold the only FDA clearance for any nociceptive pain. That means it's a treatment option for anything with mitochondria. That should be all of your patients. And if you do exotics, there's very little research done on medications and exotics, but if you have, feather pluckers, if you have lizards that are having issues, you can use the laser on them and they will respond. And anything painful, you can use a laser on without really even having to know much more. Okay, so these are the things that I look at when I have a new patient walk into a room. I look at nutritional status of this patient, and because the nutritional status of many patients is poor, we don't feed animals appropriately in our country, and so that's the first thing that I look at. The autonomic nervous system is something that we've all been taught about in vet school, but that we then really don't ever go back to, and it's what runs the body. It's such an important thing. Genetic makeup, I think we're taught about this, and I do think this is something that we look at. So I'm not going to talk a lot about genetic makeup other than things that you might want to consider about genetic makeup that maybe you hadn't previously. But we know about genetic diseases, and we know about what the certain breeds are prone to because of their phenotype and all of that. The presence of infection, obviously the presence of infection is going to inhibit healing. And if infection is present, we need to address that. The lifestyle and environment of the animal. So I think this is very important with lifestyle and environment. Again, this is catering to the household. And what is the ability of this owner? What is the philosophy of this owner? What do we need to do to get compliance out of this owner? So what are the expectations of this owner? What does this dog do? And then physical injury, obviously, if we have trauma, that would need to be addressed. So nutritional status, obviously looking at body condition is very important, and most animals in our country are overweight, and they are overweight because of the macronutrient imbalance within the diets in our country. We have way too many carbohydrates. We're feeding these animals way too many carbohydrates. We're feeding ourselves way too many carbohydrates. It's the cause of poor body condition in people as well in our country. So I look at the body condition of every animal walking in. And that helps me to understand what they're eating somewhat. Do they have really poor body muscling, or are they just fat, or are they not? Are they thin? Are they too thin? Is their gut not working? They can't get any nutrition in. Microbiome and the inflammatory state go hand in hand. I think the microbiome is an area that is rapidly expanding, and that and all areas of veterinary medicine are starting to embrace in the importance of the gut microbiome, but not just the gut microbiome. For all those ear infections out there, the importance of the skin microbiome, the importance of the urinary tract microbiome. There's all different kinds of microbiome to look at. But in nutritional status, we're probably primarily looking at the gut microbiome, and it's the one that we understand the most. Things that will influence this, and I ask people about this if I think there's nutritional issues. Does this animal have a history of a lot of antibiotic use? Because if they do, they're likely in dysbiosis. And there's now a test for dysbiosis. There's more than one test for dysbiosis. Animal Biome has tests, and so does the Texas A&M GI Lab has a fecal dysbiosis test. And so these are things that we can now look at. And do you want to get into the area of fecal transplants? It's something to get into, but then you have to have a good donor. So anything with itis in it is probably related to the microbiome. Abnormal immune responses and inflammation are generally associated with the microbiome. And what is the number one way to affect the microbiome? It's to feed this patient appropriately. I also use a lot of enzymes to get good digestion, and I do use some probiotics. So there is research out there too to support that photochemical lasers can also help balance the microbiome. So doing laser therapy can help regulate the immune system in a way that it can help balance the microbiome as well. And so the other thing I look at is the general state of the physical tissues to look at nutritional status in an animal. And I put this picture up. This picture is my dachshund. He is 5 years old, and the mouth is somewhere that, and obviously he has beautiful teeth. I've worked hard on this. He's never had his teeth cleaned. But does he chew? Does he eat a lot of bone? He does. And he does a lot of chewing, and he has to work for his meals by eating things like bones. But the general state of the physical tissues, if you open a mouth and you have a lot of dental disease, why do we think that just the bone and the connective tissue in the mouth are a problem? They're probably a problem everywhere in the body. It's just, this is somewhere to look to see what the general state of the physical tissues is. The mouth and the skin are windows into the rest of the body. And they are a place to look to be able to assess the general nutritional condition of the rest of the animal. Okay, so nutritional considerations, macronutrient balance. I talked a little bit about that. So too many carbohydrates in the diet leads to an imbalance in the microbiome, leads to more inflammation in the body as a whole. It's hard to get kibble with the right macronutrient balance. Probably the right percentage is somewhere between 7 and 15% carbohydrates in the diet of a dog. The wolf eats about 2% carbohydrates. Dogs make more amylase than wolves do. But if you think about it, even if they make 4 times more amylase than a wolf does, that's about 7%. So, and that's one of the studies that was done, came up with 7% carbs. Another one came up with 15. So kibbles are, even the lowest carbohydrate kibbles are up around 30%, and they can go up even into 60%. So if we aren't getting the right macronutrient balance, we get a fat dog with no muscle. And oftentimes, interestingly, the proteins are the same between a kibble diet and what would be considered a fresh foods diet. Now the PC term, I believe, is a minimally processed diet. Some are raw, some are lightly cooked, but the fats are the big difference. I mean, fats go rancid in kibble quickly, and they're hard to incorporate into kibble that way. And so those whole foods are best sources of nutrients. Whole fresh foods are the best sources of nutrients. And when we heat foods, we change the nutrients in them, we make them less available. In kibble, you're able to just claim whatever minerals are in there, whether they're organic minerals or inorganic minerals, and whether or not they're absorbable through the gut isn't a factor in the equations to get an AFCO labeling. So those are the whole foods in organic state is the best way to feed an animal and any animal. And then looking at an evolutionary diet for whatever species it is that you're feeding is also important. So I look at macronutrient balance in every animal that walks in, and we talk about foods. Now, is every household able to do a homemade diet or a raw food diet or a commercial raw food diet? Or no, they're not. And I work with people with kibble diets, and we go down that road, but I do my best to try to get more fats and protein into those animals' diets and try to limit the carbohydrates. So then I look at, are there foods indicated for this specific condition? If you are looking, for example, something you'd use a laser a lot for, and that walks into your clinic all the time is intervertebral disc disease. And egg yolk can be a very good package of nutrition for the spinal cord. And I know eggs got a bad rep because of cholesterol, but actually cholesterol is a huge component of the brain and neurologic system and is very important. You can grow an entire chicken from an egg yolk. It has so much nutrition in it. So when I look at the nutritional status of this animal and what condition are we working at, what organs are affected, what do we feed this animal with? And I do not shy away from proteins in renal failure cats, especially. They eat lots of protein, and I've put many cats in renal failure on raw food diets, and they live for 5, 6, 7 years. They do great. So they don't die in 1.5 to 2 years. So protein is not a problem that I have seen when it's done fresh foods and whole foods in renal failure animals. And then I look at, are there specific nutritional supplements that are helpful with this condition? And I do that almost in every patient that I see. And that is something that just about everybody takes. Because people think if they can feed it away, that's something they want to do. Okay, we're going to move on to the autonomic nervous system. So Sympathetic tone is the fight or flight response. And then parasympathetic tone is the healing tone, the housekeeping or the long-term survival response, versus the sympathetic is the short-term survival response. And we want to increase the time spent in high parasympathetic tone when pathology is present. And so sympathetic tone is going to get us away from the threat. Parasympathetic tone is going to help the body recover. So we're going to talk about things that would be helpful. So sympathetic nervous system, excess sympathetic tone can inhibit healing. This is the anxious dog that walks into your clinic, and we see anxiety in dogs now all the time, and that's microbiome. So tools to decrease anxiety. We use a laser all the time, and we do something called a sympathetic overstimulation. And this is so we ramp up the sympathetics until they come down and they reset at normal. And this can calm down a dog, but we also have a parasympathetic stimulation and a vagal nerve stimulation. These are all protocols that can be used in a dog who is anxious in your clinic to help bring down tone. And this can only be done with a class 2 laser. You can only communicate with the system in that visible light spectrum at low power. And then sedatives, you can use sedatives. These are short-term used for exams. These are the dogs who are so anxious in the clinic that they're going to bite you, or they, you want to get them into the clinic. Medications are often used, like trazodone, and trazodone is given out in our clinic like water, because there's so many anxious dogs. And this can be something too that it can be used in the short term or the long term. And then nutritional supplements I use a lot of, especially minerals. Magnesium can be incredibly calming if given into that dog every day. You can get a long-term effect. We don't have enough magnesium in foods, and especially because carbohydrates require an incredible amount of magnesium to the enzymes that you need to digest carbohydrates require a lot of magnesium. So the more carbohydrates in the diet, the more magnesium you're going to need. And the parasympathetic effect of magnesium on the body is very good. It's very calming. And then microbiome balancing. There's a direct link between the gut and the brain via the vagal nerve. And we get, with overgrowth of certain bacteria in the gut, we get anxiety. And we can get other neurologic disease as well, and other behavior disorders as well. And so I look at balancing microbiome in order to decrease sympathetic tone. Anxious dogs are not going to heal well. You need to get their anxiety down. So parasympathetic nervous system, what can we do to increase the parasympathetic nervous system? Again, we have a parasympathetic stimulation that we can do with the laser. Acupuncture, we can stimulate the parasympathetic meridians, and we can have a calming effect with acupuncture. Dopamine is associated with the reward centers of the brain in operant conditioning. This is a fantastic chemical that you should be trying to use all of the time in your clinic. This is where we get fear-free from. We are trying to release dopamine, and we are doing that by giving treats. We are trying to make this a positive experience for the animal. And puppy visit too, right? We're trying to do treats. Puppy visits so that we don't operantly condition them to be afraid of us every time they walk in the clinic, because we poke them 2 or 3 times every time they come in, and it's a painful experience for them. We need to offer something to balance that. And then many dogs are rewarded by touch. My dog here to the right, who is demonstrating parasympathetic tone on my couch, she was very easy to train just by belly rubs. She would go outside when she was a puppy, go to the bathroom, and I'd say, good girl, she'd roll over. I could rub her belly. I didn't even need to do anything else. She just loved that. So serotonin, most of the serotonin is made in the gut. So this is again, a gut-brain axis microbiome balance. If you want to use the laser to try to release serotonin, you're going to use vagal stimulation, which is the frequency is 10. Again, the great thing about the Erchonia laser is that you can program frequencies into it. And if you think, boy, we need to release some serotonin in this dog, then you can do a vagal stimulation. And then oxytocin, this is the trust and love chemical that is released in the brain. The frequency for that is 528. And this is released with social interaction. So these are the dogs that you can calm by, you got these post-surgery dog in the back who's whining, and you just decide to bring them up, put them behind a baby gate in the office, and they calm down, they lay down, they want to be around the people, they're getting an oxytocin release. Or your tech carries around the post-surgical patient who's whining in the cage until it wakes up more and feels better. These are oxytocin release type situations where you are using these parasympathetic chemicals to enhance the experience of the animal and to help bring down sympathetic tone and increase healing. Okay, so the genetic makeup of the dog. So you have a phenotypic expression, and I'm going to throw this in. I told you most people are trained in this, so I'm not going to go do too much. For an example, I put this nose over here. This dog can't get oxygen, right? So brachycephalic dogs have lower tissue oxygenation, which decreases healing. So if you are looking at trying to heal this dog with this nose somewhere, broke its leg, it did whatever, you want to try to increase healing time, and the laser will make your use of oxygen more efficient in the mitochondria. That is one of the ways that it works, is aerobic respiration over anaerobic respiration. And so you want to use every oxygen molecule you can get out of this nose. And these are situations where you might want to use something, if you have other tools in your toolbox, what are you going to do with this nose or this inability to oxygenate tissues? We know they have lung problems, and, they can't breathe. And so what can we do to try to get as much as we can out of this system? Okay, presence of infection. Presence of infection inhibits healing. Antibiotics can affect the microbiome. So do we always want to use those? I just talked a whole bunch about the microbiome and how it affects the rest of the animal, and antibiotics can set up long-term dysbiosis and make them more prone to chronic diarrhea and other issues, and the things that go along with that, which are anxiety, dysbiosis and anxiety, and dysbiosis and allergies. So if we can get away with not using antibiotics, or not using them as long, or using them topically instead of using them systemically, these are some ways that we can augment antibiotic use. So the 405 nanometer wavelength laser, the violet head, we know when I talked about that ultraviolet light being damaging, but that it ionizing and that it's damaging to tissues. We know it will kill bacteria, and we kill viruses with ultraviolet radiation. Now, when we get into the violet, just into the violet range at that 405, the violet range starts at 400. We continue to have that effect, but we don't have the damage to the mammalian tissues, or we are actually beneficial from the standpoint of that's in the visible light spectrum. It's harmful to bacteria, and there are Malia can get you studies on this if you want, as far as the antibacterial and antiviral effects of the laser. So we can use that 405 head on infections, especially infections like when you have Pseudomonas, and it's got every problem, and it's resistant to every antibiotic that you try to use on it. We had our referral hospital telling us to anesthetize these dogs and do bleach rinses in their ears, because there's nothing that is going to affect it. The 405 nanometer wavelength laser can be helpful with that, as well as I also use skin probiotics on these guys. So there's other options out there than just trying to kill off all of their flora. We can try to enhance their flora, and in that 405 nanometer wavelength laser is a wonderful tool in the fight against infection. And again, we want to decrease the antibiotic courses in dermatitis. We don't want this dog on antibiotics for 4 weeks, 6 weeks, 8 weeks, if we can get it done in 2 or even 10 days. I also use herbal antibiotics. I use topical antibiotics when I can. I use probiotics ingested or topically. Again, I use some skin probiotics. And then we also would like to decrease antibiotic use because antibiotics are sometimes really necessary and they save lives. And if we can avoid antibiotic resistance, then we can preserve antibiotics as a tool to use in the future. Okay, lifestyle and environment. So is this animal an athlete, a working animal, or is it a couch potato? What do I need to get this animal to do? Because if this is a 14-year-old animal that the people just want the quality of life to be good enough that they can go out and go potty and come back in, then that's a lower bar than if this animal is an athlete. And I have some athletes as patients, and we laser them to improve their athletic performance, even when there is nothing wrong with them. So the laser can be used, if you have those people, the laser can be used to enhance athletic performance. And my kids play hockey. I use my middle son is on a high school hockey team, and he brings the laser. We have a personal laser at home. That's how much I like my laser. I bought a laser and have one in my household to use on me and my kids and my dogs at home. And he brings the laser with him to hockey games because he lasers himself before games, and he's found that he performs better when he does that. He has more endurance, and his leg muscles don't tire as quickly. Remember, we're trying to keep in anaerobic respiration for longer periods of time. So you can offer this as something if you do have animals that are athletes to enhance athletic performance. So I also look at environment because I see many, many animals that I do detox on. And the liver is something that we do not address enough. If you talk to people who are in liver failure, they are itchy. And I spend an incredible amount of time detoxing my allergic patients. The animals that come to me with allergy problems generally do some kind of a liver detox. And remember when I told you that because we're affecting mitochondria in the cells, whatever we're lasering is going to perform better, that we're making the cells perform better. That's what we're doing. We are helping the cells to make more ATP and have more ability. And so the frequency for laser, the laser frequency for the liver is 53. And I use that a lot because toxicities are in the environment everywhere. And the older the animal is, but some households are even more toxic than others, and some foods are more toxic than others. So I do this with nutritional supplementation with whole foods that are supportive of the liver. The brassicas, broccoli, cauliflower, beets are very supportive of the liver. These are things that I use in my allergy patients to help them. And I use a beet fat, Yakatron, beet fat liver extract to help them to detox as well. It's been studied in Japan. And then the expectations of the household. A lot of times, again, is this just a 14-year-old dog that the owner doesn't want? And I've had success in lasering for incontinence. Are they house soiling? Are they just trying to get them to be able to make it outside? So I'm going to just do two real quick cases here. Rio is this dog on the right. He is a dock jumper. He's an athlete, and he was having some issues that the owner, who does canine massage and she works with range of motion and different things in dogs, brought him to me and said he's got this little bit of swelling in the carpus. He's not performing the way that he was. And this dog walked around the room. You couldn't tell he was lame. There was nothing really abnormal. He had a slight bit of edema around the carpus in the left leg. And you couldn't quite get full range of motion back in that shoulder. She gave me this picture actually, because she said, look at, he's got his range of motion back in that shoulder when he's dog jumping again. So she had taken him to I'm a part of her team. I do nutrition. I do some other things for her too. I'm her primary veterinarian, but I have no issues in working on a team. And she takes her dogs because they are athletes to, she takes them to see a rehab vet, and this dog had been to the rehab vet and had been lasered with a class 4 laser. This dog had been also to a chiropractor and had his neck adjusted. And he had also been then he went to MSU, where he saw a rehab vet and was lasered with a class 3 laser. So he had all that treatment, and it all found something a little different. One a shoulder, and then the triceps area, he was tight, and the ligaments. But it wasn't until I lasered him with my class 2 laser that the edema went down, and that he got full range of motion back in that shoulder. And she had already had laser therapy done with other lasers in other places. And she, after the first one, bought a package to continue to have laser therapy done in my clinic. And I'm not a rehab vet, and this is not my specialty, but he responded to that when he hadn't responded to class 3 and class 4 laser therapy. So you don't need a lot of power. You need the right wavelength, and you need maybe you need the right frequencies. And then Blue was a Blue healer, and he was one of my very first ACL patients. Blue, his owner was not very creative in naming him. He was a Australian cattle dog. He was Blue healer, and he was a show dog, and he was he was at stud. He was making money for the owner because he had won some shows, and he was also a working cattle dog on his farm. He was working cattle. He was in Ohio for a show, and he came up lame in a hind leg. And the owner took him to see the local veterinarian, who said he had an ACL injury. And then he was referred to an orthopedic surgeon, and he went to the orthopedic surgeon, and the orthopedic surgeon said that he needed to have surgery. And so for those of you who are familiar with show, you cannot show a dog who has had surgery. It would have ended his show career. And so he was looking for anything else to possibly do to not have surgery on this dog. And this dog had to return to athletic performance to work cattle on his farm. And so he called us. We were his primary vet, and we were in Michigan. He was in Ohio. And he said, "Is there anything I can do to avoid surgery?" And I said, I just bought this laser, and I'd had it for about 6 months. And I said, there's a protocol for ACL injury. Why don't we do that and see what happens, and see whether or not, 12 weeks later, do you need surgery? So the dog came in, and we lasered him, and he did fantastic. He was no longer lame in 12 weeks. He was working cattle in 3 months, in 6 months. And he was 3 years old at that time. I actually, this was, one of my patients. So he was euthanized in 2001. He was 13 and a half years old. And he continued to work cattle through the rest of, until he was about 11. And twice he came in for a touch-up on that knee that the owner said, he's a little lame, or he's a little stiff, he needs a touch-up. Twice he came in, and he continued to work cattle for 11 years. He continued to show, and he continued to be a stud dog. So he did not have to have surgery. Okay, physical injury, trauma to the tissues. So this is where laser is just so well documented as working very well. However, if you have a broken bone, you only want to use a class 2 laser on a broken bone. It has been shown that class 3 and class 4 lasers can inhibit osteoblasts. And so same thing with brains and tissues that are metabolic tissues. Like, you wouldn't want to use a class 3 or 4 laser on a thyroid. You wouldn't want to use a class 3 or 4 laser on a brains or on adrenal glands, but you can use a class 2 laser. Is safe Again, visible light spectrum, low level. You're not going to hurt anything. And it is anti-inflammatory. Cell proliferation for any tissue damage via an increased ATP production, therefore photochemical lasers only, not photothermal. We don't want to heat these tissues. That brings more inflammation into them. We want to increase ATP production and get the photochemical effect of the laser on injury. And again, the London dispersion effect. So when I was talking about this work can spread through the whole body just by exciting electrons and readmitting wavelengths of light. So when you do that, that's called the London dispersion effect. And we get, if you have a dog in a cast and you can't laser, you can, that will also go through the cast, but you can laser above the cast and get good penetration all the way down the leg to the fracture. You can laser the other leg and go over and get the same, not the same, you're going to get the highest dose wherever you laser, but it's going to spread through the whole body. And we've seen this in studies where they've made incisions on rats on both sides of the body. They only laser one, then the incision on the other side heals faster than the controls. So it's well established, it moves through the whole body. And you can laser, you don't have to laser, try to get through a cast. You can laser up on the shoulder and it'll go down the leg and you'll get a faster healing effect. Same thing, think about this. You have dogs, whether they have surgery or not, who have ACL injuries, high likelihood they're going to tear that other one, right? Why don't we laser that too? Or we're going to get an effect and try to heal the pathology in that ACL as well before it tears. Preventative. So I also, whatever skin or, or fracture or whatever it is, I put these guys on either some bone supplements or connective tissue supplements, ligament supplements. I have all different kinds of nutritional supplements. I have a cupboard full of nutritional supplements in my office. So that's something that I add. And then obviously stabilization. If this is a fracture, let's stabilize it with a cast or with a pin or with plates or whatever it calls for, which would be maybe down the surgical realm, maybe not. And then sutures for, a wound, we would suture it together. So stabilization, also very important. So I just did 2 little treatment plans here to wrap up as to what I would do in something that you see in your clinic all the time. And I'm going to tell you how I would build a laser for these kinds of things. So treatment plan, ear infection, they walk into your clinic multiple a day, right? I mean, this is something we see every day, all the time. So I talk to these people about a diet change, about decreasing carbohydrates in the diet, increasing proteins and fats. I often do some kind of an immune support because there's usually an underlying allergy issue. Again, we are trying to change the microbiome. I would laser it with a violet head laser. The red and violet come together. And again, Malia will talk to you about the different Erchonia lasers. And so I would do a 3-minute laser on this ear, and then I would charge. We have multiple charges, and then obviously a topical ear med if needed. So if it's just a little bit, I won't even put an ear med in these guys. I'll clean them out and tell the owner to clean the ear out every 2 to 3 times a day with something that is acidifying in the ear. If they are, ooh, this dog's really uncomfortable, I'm going to treat it. I'm going to treat it with something topical. And I'm going to laser it too. That's going to help with comfort pretty quickly. So in this treatment plan, I have multiple charges for the laser. We have laser with office visits. And the laser with office visit in our office, again, everybody lives in different part of the country, has different clientele. You can do whatever you want. I charge $25 for a 3-minute laser treatment. Added on to, the office visit, whatever else we do. 3-minute laser, $25. There's already an office visit charge. versus something like if this were an IVDD dog, which you again see all the time. Again, this is an itis, this is an inflamed dog, and we need to try to prevent that from becoming worse. So diet change, I always talk about diet change, musculoskeletal nutritional support. And then I will go into a laser protocol for spine musculoskeletal. I'm going to look at this dog. Do we have neurologic signs? Do we have, so this is going to be a far more in-depth laser protocol. We might be a 6 or a 9 minute treatment. And I'm going to design it specifically to this dog. So depending on what tissues are involved or what tissues I think are involved, which is going to be different if this is just a really painful, like muscle spasming dog, especially necks, versus I have proprioceptive deficits in the hind end. So there's clearly a neurologic component to this. So I'm going to choose that protocol and frequencies. And it's not going to be a quick 3 minute, this is what I use for an infected ear. It's going to be, I'm going to write a protocol, put it in the book. This dog's going to come in for multiple laserings, and those laserings are going to be $50 a piece because they're going to make follow-up appointments with my tech. Again, I'm billing when I'm not there because there's a protocol in the protocol book for them. If I think it's going to be longer, we offer packages. We have a package of 6 and a package of 13. And essentially, it's $250 for 6, which is, buy 5, get 1 free. And then it is $500 for 13 of them. So, and again, depending on where you live in the country and in your clientele and all that, that might be more, it might be less. It's what your clientele can afford and what you need to do in your clinic. So we have all those different packages. And then we also have a pre and post-op charge. So lasering incisions. Yes, you should laser every incision when you cut an animal, it heals faster. Laser before you even cut them. There's a benefit to that. So we do 2 laserings with a surgery. That is I think a $20 charge. Our techs do it while they're waking up the animal. It's a set protocol. And we don't do declaws anymore, but when we used to do declaws, we put in a 3rd lasering, and I think it was a $25 charge instead of a $20 charge. So it was a laser for the declaw, but we don't do declaws anymore. So the other thing that I would do in an IVD dog is I would manipulate them. So that would be and I would use both the red and violet light. The red light is really helpful for inflammation and can help with pain very quickly. And the violet had carrying more power, right? Or more energy. Actually, you can get a longer term effect. The long term is better with the violet. The short term is better with the red. So the combination of the 2 of those together, I would use for an IVD dog. And if anybody has any questions. And Malia, I don't have questions on my screen.
I don't have to leave it yet. We're going to leave the chat box open, and I'll go ahead and take the screen back from you real quick and then
Okay.
put on the presentation here so we can go over the differences.
Yep.
And again, if anybody does have questions, you can type it into the chat box or in the Q&A. We will send out a replay link for anybody that is registered for this webinar. So anybody that has not been able to watch the full entirety of it, or if you wanted to watch it again, you can always get in touch with us that way too. So we'll send that out to everybody at the end. Can you see my screen okay? Oh, did it go away?
I am not seeing your screen.
Okay, let me pull that back up again.
I see your screen now.
Okay, excellent. Let me put it on the presentation. And at the beginning of it would be good. Still doing okay?
Yep.
Okay, excellent. So thank you again, everyone, for joining us today. Again, my name is Malia Ellis. I'm the Erchonia Veterinary Sales Manager. This is my contact information here on the screen. I am the sole veterinary manager for everything at Erchonia. So if you have any questions pertaining to the lasers or anything in the animal or veterinary side of things, please feel free to save my contact information. You can even scan that QR code right there at the top of the corner there. But these are my reasons why here on the screen. These are my two pugs here. They are my passion for everything that I do here at Erchonia and making sure that they are healthy and not having any issues. And so we do use the lasers at home for them all the time, including for just in general arthritis for my older pug Mango. My younger pug, she's not that young anymore. She's not a spring chicken. She's only 9 years old now, but she actually has a history of getting anal gland sacs that have gotten too full and actually come up to a point where she had to abscess and they had to drain it beforehand. And the reason I bring up that story is because when I was away on a work trip, my parents were pet sitting for my dogs and they were taking care of them while I was away. And they said, well, we'll just take her to the vet, and didn't bring it up because I was away at a seminar. Not knowing anything, they thought that the doctors were going to have a laser and they could use the laser on her and she would get better. They didn't realize that all lasers are not created equal. So what they do know now, but they did have a class 4 laser that they did use on her that was actually to do just after they did the drainage. And instead of it actually helping to heal the tissue, it made it even more inflamed and puffier when she had that. And it also created a kind of an infection that was there. Luckily, I came home the next day. I used the EVL, which is the violet and red laser, on her. I only did it for 1 minute that one day. By the end of the day, her entire abscess had completely decreased in the inflammation, and it did go back into light pink tissue. It was looking really nice and healthy, and it did scab up just within that one day. The next day, I did one more treatment, again, just only 1 minute. And she got up and walked away right afterwards. And that by the end of that day, on day 2, after just the second treatment, that scab had completely fallen off and there was new healed tissue underneath with no more inflammation, and there was no infection with that. So you do need to be cautious. I'm not going to tell you not to use your class 4 lasers or class 3 lasers because you may be getting some really great results with that. But this is to point out what you can do complementary with the Erchonia lasers and how these can be an adjunct to what you can do. Now, you will see that a lot of the research that we have, as well as the clinical experience, these lasers can do the same thing, but better than the class 3 and class 4 lasers. So sometimes they do end up phasing out those lasers in your practice. But again, not necessarily here to replace them. I'm just here to show you what you can do in addition to what you're already doing fantastic. So when we're talking about lasers, Dr. Starr did a great job of going into the different aspects of the wavelength spectrum. So she went into the microwaves and the high heat, and then all the way on the opposite side of that with the low wavelengths like gamma rays and X-rays. And we are right in that visible light spectrum. So every single one of our wavelengths is going to be completely non-thermal, also non-ionizing. So you do not have any of those side effects or adverse events that you would have on either side of the spectrum for this. You're completely in the safe zone with this, but you still have significantly higher energy. So we are actually the most energetic lasers in the world. We are the most researched wavelengths and lasers in the world as well. But as you can see here on the screen, the lower the wavelengths, the higher the electron volt potential or the photon energy is for those wavelengths. So you can see the violet laser has a lower wavelength than the red, so it has significantly higher energy per photon going into the body. And this is not to be confused with the ultraviolet, because ultraviolet is off of the visible light spectrum. It's actually below. But with the violet on the visible light, you get a lot of the same benefits from that antimicrobial effect, but without the ionization that you would get when you're lower than the visible light spectrum. So that's just kind of a breakdown of the wavelength spectrum here. When we're talking about the electron transport chain, which Dr. Starr did a great job kind of showcasing how this works, and you don't need to go back to school for vet school or even pre-vet for your undergrad to even look at this again, but just to kind of break it down, when we're talking about this electron transport chain, there's 4 complexes in this that is enabling the mitochondria to create more ATP, amongst so many other functions. But when we're looking at this, Erchonia has actually dove in so deep into the studying of the mitochondria that we've actually seen that the 405 nanometers is the peak absorption for complex 1 and 2, whereas the 530 or 520 range is going to be right around complex 3, and then the 635 nanometers at complex 4. Well, when we're looking at this, Two of these wavelengths are specifically Erchonia wavelengths that we use because these are the peak absorptions for the electron transport chain. That's just showing you exactly how this is working and how we are actually affecting the mitochondria to do so many different functions. Now, this is a clinical trial because we do see in the human market where a lot of people are asking what's the difference between the red by itself versus the red and the violet. This is a screenshot of the chart here from our neck and shoulder pain FDA clearance where we did just the red handheld versus the red and violet combination. And you can actually see that the red and violet actually had a larger pain reduction and a longer lasting pain reduction post-treatment. It also significantly better increased the improved range of motion as well. So if anybody would like a copy of those studies, I'd be happy to send this over to you. But that just shows you that the red and violet option can do the same thing, but faster and a little bit better than the red alone. And it has additional benefits. So we're going to showcase some of that in the laser stuff here as well. A little bit of background of Erchonia is we are a family-owned and operated company. We were built and manufactured in 1996. Since then, we now have 21 FDA clearances, which is more than any other laser company combined. There are only other laser companies that do have FDA clearances have a substantial equivalence to a heating lamp. But we are made and manufactured in Melbourne, Florida. We're 85% self-reliant. We are FDA, ISO, OSHA compliant, etc. So much is there, but we are here for quality and not for the marketing side of things. We're not just going to be falsely advertising anything to you. Everything is done through these double-blind, placebo-controlled, randomized, and multi-site clinical trials. This is the gold standard of research when we are dealing with clinical trials. So a lot of the things that we're going to see in the Erchonia lasers as well are brain-based research going forward as well. So in the human market, we have autism, Alzheimer's, and Parkinson's FDA clinical trials undergoing right now with phenomenal results. We're also doing psoriasis and peripheral neuropathy, again, phenomenal results. But that's just to go to show you do not want to ever put a class 3 or class 4 laser on any animal's brain. You would be literally microwaving and heating the tissues, which would cause damage on top of the fact that you have too much power to stimulate. So these lasers are completely safe with Erchonia lasers to treat on the brain to do for the parasympathetic, sympathetic calming, for the emotional aspects, for traumatic brain injuries or neurological conditions. These are safe to use. For our FDA clearances, like I said, we have lots of different research that's out here. If you're looking for specifically equine or small animal, we have antimicrobial articles. I'd be happy to share with you some more research as well. I'm going to fast forward through that because I have to delete the talk being on there. But we do have, like I said, over 21 FDA clearances. For this flexibility and diversity, we've kind of gone over the fact that we are in the human market. So not just limited to medical doctors or orthopedic surgeons. We have chiropractors, physical therapists, pain management, acupuncture. It's phenomenal in acupuncture. Of course, veterinary medicine, spas and salons, and so much more. This is not going to be just for small animals, as we kind of touched on. Again, we can do it in the exotics as well, because you do not have to touch the patients. You can actually treat from a distance with the Erchonia's line-generated beams. This is really nice because you can actually disperse that energy over a larger surface area to be able to target a longer or more potent area with the same energy. And that does not diminish the energy going into the body. So you're just able to cover more surface area to get a larger treatment area with that. This is our VLS laser. This is the newest generation of our single red handheld laser. It's very portable, pocket size. It is completely programmed for your animal presets, and it does have additional 100 blank spaces that you can program in additional animal protocols. As you see here on the screen, it has 2 red beams. So these are at 635 nanometers. And this red laser is going to be it does so many other things in addition to this, but the key points are going to be decreasing pain and inflammation while stimulating the cellular healing and communication. This laser runs for $9,900, but we do have a show special available for anybody that's attending the webinar today. And then we get into our more popular laser, which is the EVL. And as Dr. Starr was talking about the violet laser a lot and how she wanted that specifically for both of the offices that she works in and why you do need that antimicrobial violet light. In the beginning, we talked about the extra energy that you get with the violet. So we're still getting all the same great benefits of the red with this laser. So you're still going to be decreasing pain, decreasing inflammation. You're still going to be stimulating that cellular healing. You're going to do all of that faster because you have more energy with the violet light, as we saw in the chart with the two lasers compared to each other. And then you're also going to get incredible antimicrobial effect. In the human market, this laser actually has an FDA clearance for acne for the antibacterial side of things. And we also have an FDA clearance for toenail fungus to knock out that fungal side. We have incredible studies in case outcomes with antibiotic resistant MRSA reacting to this violet light as well. And it is all specific to that 405 nanometers. So really, really incredible. There are emotional complexes to this as well. So we can be targeting and balancing out the sympathetics and parasympathetics simultaneously with this laser. So again, this is a very portable laser. It's easy to be moved around. Comes preset with your animal protocols, but then you have the ability to program in up to 100 additional protocols. This one runs for $15,900, but again, we do have a show special for you as well. If you are looking for the presets, like I said, this is going to come preset in there, and we're running a little short on time, so I'll skip over this, but we'll go over this in any training if you do decide to move forward with a laser. This is our FDA clinical trial with the red and violet compared to just the red by itself. So if you want a copy of this, I can send that over to you. And here's that clinical study where it is actually showing the antibiotic resistant MRSA being completely photo destroyed by that 405 nanometer light. The base station is going to be the most well-rounded. This is also a great option if you have multiple doctors in your office. Maybe you're a single practitioner, but you have several vet techs. Maybe you want to do a laser rental program, which is going to be a huge thing. That's probably going to be our next topic of our next veterinary webinar that we'll be doing as well. So we'll be talking about the laser rental program and why you would want to implement something like that as well, because these are so safe to go through and go home. This can be customized, but traditionally the base station is going to come with 2 VLS red lasers and 1 EVL. If you wanted to customize that and substitute one of the VLSs for an EVL, it's only a $4,000 upcharge for that. This runs for $29,900, so it's already a 17% savings by buying in bulk with this. If you do like the unattended lasers, this is our FX technology. It's a completely set it and forget it technology where you can literally position the lasers. You can treat an animal stationary in a cage. You can put them into a harness if you want to keep them onto like a aerobic exercise. Maybe you're training them and have them on a treadmill while you have the laser going at the same time. This gives you a lot of flexibility to incorporate the activation with the laser at the same time. So this is really incredible. Dr. Juan Casillas does use these in his practice. So if you want to see a copy of those or how he implements that into his practice, I can send you those webinars. Just let me know. Our FX405 partners both those wavelengths. So just like we talked about with the handheld lasers, you now have the set it and forget it, completely unattended protocols with the red and violet together. Here's a summary of some of the applications. I know Dr. Starr kind of talked about different things that you can do with this, with arthritis, wound healing, spinal trauma, laminitis, dermatitis, infected wounds, allergies, gingivitis, and all different types of treatments. So your standard treatment times are kind of at the bottom there, 3 to 5 minutes. I usually suggest 3 minutes for small animals, 5 minutes for larger animals. And if we're dealing with acute conditions, I usually start with 6 treatments, chronic conditions, 12 treatments. Twice a week is great, but of course, if you can do the laser rental program, we can get them better faster. So when we're talking about building these treatment protocols, you can do multiple treatments in one day. You just want them about 2 hours in between. So that way the body can absorb more energy. Never going to have any adverse events. You're never going to overtreat. Think of it as kind of a cup of water. When a cup of water is completely full, adding in more water doesn't add any harm, but it doesn't add any more benefit as well. So that's very similar with the Erchonia lasers. You're not going to have any side effects, but your body's our bodies and the animals' bodies are going to reach a threshold or a plateau for how much energy they can accept in a given amount of time. After about 2 hours, it does go down. We do have client education so that you can actually showcase what these lasers do for the clients and the owners so that they can understand what they're investing into and why these lasers are a great option for them. And then here's our clinical or our cost of laser systems. Ignore this date. I forgot to change that up there, but this webinar special is good until the end of January. And we are taking $500 off of our VLS laser, $1,000 off of our EVL. So that brings it down to about $200 to $300 a month. And then the base station, as I mentioned, is already a 17% savings. So that's about $638 a month. So I'll talk to you about how you can get that paid off. If you're interested in the FX laser scanners, those are listed at the bottom there for the show specials as well. If you have any of our older models of the lasers, many of our veterinarians have an older base station or even an old PL5000. Maybe you have any of our previous generation VLS or EVLs, or even those base stations. Those are all fantastic for using as a rental option, or if you're just looking to get into one of our newer lasers and want to trade up, just let me know and I can get you a price for a trade up option so that we can get you into the newest and most advanced lasers that we offer now. So why implement a laser rental program? One is because it creates a passive income for your practice. It's going to also allow you to get the laser treatments in faster for faster outcomes. So as we talked about those acute, moderate, chronic injuries, we're going to doing a base of 6 treatments. So you can either space that out once a week for 6 weeks, or you can have them rent a laser, take it home and get in all of those treatments at home without having to come back into your office. It also allows you to get this passive income that can invest into a new wish list item for your practice. Whether maybe that's a new unattended FX laser, or maybe you want a new X-ray machine, but this gives you the opportunity to send those lasers home and actually have a passive form of revenue stream. Who's a good fit to rent these out to? Pre and post-operative patients are going to be huge for this. Getting those laser treatments in pre-surgery or even post-surgery for incredible outcomes. We actually have an FDA clearance for pre and post-operative pain reduction in the human market. Acute injuries, chronic injuries, TBIs. If you have busy owners, they can't get into your office maybe multiple times a week, or maybe even once a week is too much for them. So that gives them the flexibility to take the lasers home and still take care of their animals at home without having to come into your office every single time for these treatments. Rehab vets, mobile practices, families with multiple pets. There's so many options for this, for the laser rental program. Like I mentioned, having these older models is key and a great option for renting out the lasers because they do give you the opportunity to have the newer models in your hands and you can send the older models home for a rental program, and that will cover all that. So I do have a lot of people that end up selling these to patients as well, and they end up getting a new laser for their clinic outfit too. Laser program or rental program suggestions. I break this up into 3 different tiers. The tier 2 is usually the more standardized, but I like to give you just different options for this. So the tier 1 is going to be a little bit more expensive, but if you're in a more affluent area, this might be a great option for you. You do $800 to rent a laser for a month or $350 to rent for a week. You can do daily rentals as well, but of course the weekly, monthly rentals are more common. Tier 2 is a little bit less expensive. This is going to be more of a rural area. So in those cases, if you have $250 for a week or $600 for a monthly rental, and then if you have a special program, maybe you have athletes, maybe you work with specific equines or show animals, specialty rental program is about $700 a week for the rental program. So this easily pays for an entire base station by renting out 1 laser a month. If you're renting out 2 of these lasers a month, you still have 1 to use passively or actively, in your practice, and 2 of those are getting you the laser rental revenue coming back in. So that's why a base station is really the most well-rounded. Gives you lots of options for treatment protocols. If you are doing just general revenue, if you want to do a return on investment, I can send you this calculator so you can plug in your numbers. $30 is a little bit on the lower end of the spectrum, but just keep the math simple. If you were to do 5 patients a day, if you did this in a 5-day or a 4-day work week, you would have 20 treatments in a week. Each day, you'd be making about $150 at $30 a treatment, and your revenue per month is going to be about $2,400. Again, base station, you're tripling that because you have 3 lasers. So this just kind of breaks down how much you're going to be seeing on the return on investment. If you are interested in learning more about the lasers in all different specialties, Dr. Chad Woolner and Andrew Wells actually have put together a laser light show podcast. And so we have surgeons, acupuncturists, nurse practitioners, chiropractors, neurologists, veterinarians, and so much more. So this is a great opportunity to just kind of listen to the remarkable outcomes through the fields of medicine with the Erchonia lasers. And then if you did want to save my contact information, if you have any questions at all, you can scan this QR code. Again, my name is Malia Ellis, and I am the veterinary sales manager here at Erchonia. This is my cell phone number and my email, and I am happy to answer any of those questions. Again, those show specials are good until the end of this month. We do have a little bit of a leeway because we're already kind of close to the end of the month right now. But since we're a little bit over on time, I am going to go ahead and let everybody go. But I wanted to say thank you so much, Dr. Starr, for joining us today, for presenting on how you've used the lasers in your practice. And thank you to everybody else who has joined us virtually. If you have any questions, please let us know. Thanks so much.
Thank you.